in the operating room. Sounds complex, doesn't it? But maybe it doesn't have to be? Hi, I'm Amy Gardner, Associate Dean for Faculty Development at the University of Colorado School of Medicine. Spend a few minutes with Dr. Michael Cripps, Trauma and Acute Care Surgeon here at the University of Colorado School of Medicine, and learn about how he has adopted an approach for intraoperative teaching that breaks the learning experience down into 3 steps, and how he seamlessly integrates these teaching elements into his clinical practice.
If you're a surgeon like me, you know the complexities of being in the operating room. We're not just performing a procedure on a patient. We're also managing a team, reacting to any changes or unexpected events, and making high-stakes decisions, all in a very demanding and fast-paced environment. Adding the responsibility of teaching into all of this can be tough, but making space for teaching in the operating room is essential. I'm Michael Cripps. I'm a professor of surgery and the section chief for trauma and acute care surgery here at the CU School of Medicine. And I'd like to share with you a framework that I found to be a helpful addition to my teaching toolkit when they're in the operating room. Research has shown that teaching in the operating room can be broken down into 3 phases: briefing, intraoperative teaching, and debriefing. This BID model has been tested in the literature and shown to be an effective way to structure learning experiences and be deliberate about teaching in the operating room. Let's walk through each of these steps together. The first element of the BID model is the briefing phase. This is a short 2 to 3 minute interaction intended to assess the needs of the learner, encourage the learner to assess their own learning needs, and jointly establish goals for the procedure. In my practice, I start this conversation at the scrub sink with a brief question to the learner about their goals for operation or previous experiences. We go from there to jointly establish goals and learner roles for the procedure. By setting learner goals at the beginning of the operation, we can focus our attention on those agreed upon goals, and I also have a plan to guide my teaching during the operation. The next phase is intraoperative teaching. The objectives we set in the briefing phase focus on intraoperative teaching. By focusing most of the discussion during the procedure on these 1 or 2 learning goals that we just created, we can ensure deliberate discussion of the prioritized topics rather than a non-specific flow of talk. Our learning goals also help me know where in the procedure to slow down, assess knowledge, and ensure the learner has an appropriate amount of involvement. After the operation is finished, we then can debrief the encounter. I like to do this during the closing so it can seamlessly fit within my existing routine. During the debriefing, I ask the learner to reflect on their performance or attainment of the agreed upon learning goals. Asking the learner to first assemble their thoughts allows me to understand the learner's perspective, pick up on any problems the learner is having with their perception of the encounter, and reinforce or correct as needed. Importantly, the debrief can also allow for jointly planning of future learning goals and creating any action items the learner should work on before the next procedure. The BID model has helped me be deliberate about teaching in the OR. It's easy to remember, fits easily within my existing routine, and is flexible enough to use with early stage learners and even those with more experience. I'd encourage you to try it out and see the benefits for yourself.